In the year since 20 children and 6 adults were killed at Sandy Hook Elementary School, the push for stricter federal gun control laws has failed. Here's what has changed: increased funding for mental health programs across the country.
We found that since 2008, the public mental health system lost close to $4 billion. And we think that Sandy Hook opened up the eyes of governors and state legislators and policymakers around the country that mental health has been cut enough.
36 states increased their mental health care budgets in 2013.
We know that there's a number of states that have reversed long-term trends and cuts in mental health services, and we commend the states for doing that. Texas, South Carolina is on that list. Colorado, Governor Hickenlooper has done enormous investment in mental health services. Colorado is obviously a state of concern given the Aurora shootings.
On July 20th, 2012, James Holmes walked into an Aurora, Colorado movie theater and opened fire, leaving 12 people dead. The state increased its mental health budget by 13.5% this year, which included $20 million to improve crisis centers. Texas, a state ranked at the very bottom of the list for mental health funding per capita, made its largest budget increase ever this year. Much of it will go to training teachers to spot the early signs of mental illness.
Because there's largely been bipartisan agreement that there are gaps in the public mental health system and that there are consequences of those gaps, and a recognition on the part of Democrats and Republicans that cutting mental health has severe downstream consequences in terms of even greater cost.
Change is coming at the federal level, too. On December 10th, Vice President Joe Biden announced $100 million in new funding to strengthen mental health programs. And about a quarter of all mental health services come through Medicaid, so the issue has been brought into the debate over Obamacare. 25 states have elected to expand Medicaid, 23 have not, and 2 states haven't decided yet.
We are hopeful that this expansion of Medicaid is going to bring new coverage to a large number of single individuals, adults with serious mental illness, but it's only going to happen in states that agree to expand their Medicaid standard.
But the question remains, will this increase in spending lead to fewer mass shooting incidents?
Well, we don't exactly know yet. We have more research to do, but once we get that research done, it's going to take investment in public mental health services, and what the evidence is telling us is effective in early identification and early intervention.